All these infants are approximately the same age, yet there are many differences between them. Not only do they have different heights, weights, and body builds, but they are also at different stages of motor development. Every child has his own unique rate and style of development. There is, therefore, a very wide range of physical growth and motor development which is considered normal. It is well to remember that there is no strong relationship between physical development and mental development. A child who is precocious in creeping and walking will not necessarily be precocious in language or concept development. Although babies have different potentials, physical growth and motor development do tend to follow predictable patterns. One such pattern involves changes in body proportion. At birth, an infant's head comprises about 1/4 of his height. An adult's head comprises only about 1/10 of his height. A newborn's arms and legs are relatively short, but as he develops, his arms and legs grow much faster than his head or torso. Another predictable pattern of development involves changes in motor response. A young infant responds to stimulation with undifferentiated gross movements. His whole body reacts when an ice cube touches his foot. And once a baby has begun a particular behavior, he may have trouble inhibiting or stopping the behavior, even though it's no longer appropriate. For example, if something makes him cry, he may continue to cry after the stimulus is gone. The degree of neurological development is one factor which determines how quickly a baby is able to change from one behavior to another. As a child gets older, his motor activity becomes more differentiated and specific. When something cold touches his foot, he moves just his foot rather than his whole body. And he can inhibit and change his behavior or state more quickly and easily. Still another predictable pattern involves the direction of development. In general, an infant develops vertically from her head to her feet. This is known as cephalocaudal development. Thus, a baby can control his eye and head movements before he can sit up by himself. And an infant can control her back and arms well enough to sit long before she can use her legs for walking. Also, in general, a baby develops horizontally from the midline out. This is known as proximodistal development. He can control his shoulders and arms before he can control his hands, and can grasp an object with the whole hand long before being able to pick up a small object with the tips of the fingers. Even though every baby develops at his own rate, the predictable growth patterns make it possible to establish norms of development. In the 1920s and 30s, Arnold Gesell tested a number of infants and calculated the average ages at which different developments appear. From these tests, he established norms in several areas, including gross motor and fine motor development. Since Gesell's initial work, newer tests of norms have been devised. Developmental schedules based on norms can help health professionals determine if a child's total development falls within the wide normal range. And if a child's size or motor development were to lag far behind these norms, the healthcare provider would be alerted to search for further signs of trouble. It is well to remember that children do not develop exactly according to any schedule. However, norms do serve a useful purpose by describing typical development. The wide range of normal growth and development takes into account the fact that sex differences affect growth rate. Newborn girls have proportionately more fat and less muscle tissue than boys, and they are usually shorter and lighter than boys. On average, girls develop faster than boys and at a more constant rate. Another difference relates to activity level. There is evidence that infant boys are more vigorous than girls. In addition to genetic and gender influences, environmental factors affect physical growth and motor development. These environmental influences begin even before birth. The pregnant woman's consumption of alcohol or other drugs can affect her baby's later physical growth and motor development. Growth retardation, congenital anomalies, and hyperactivity are more common in babies whose mothers drank. Also, a pregnant woman who smokes is more likely to have a child with measurable differences in physical growth and development. At birth, the weight of a smoker's baby is reduced by an average of 180 grams, and the mortality rate of the baby just before and after birth is increased by 30%. In addition, inadequate nutrition of the mother both before and during pregnancy can also adversely affect the child's development. Maternal ingestion of inadequate proteins and calories between 26 and 32 weeks of gestation can permanently reduce the number of fetal brain cells by as much as 40%. And after the child is born, nutrition is still one of the most important environmental factors affecting growth. Significant dietary deficiencies result in severe malnutrition. Lesser deficiencies, which are more commonplace, also have a detrimental effect on growth and development. Without an adequate and balanced diet, bones and muscles do not grow to their optimum size. Serious malnutrition can prevent the head from attaining maximum capacity and may limit brain size and the number of cells. In addition to its influence on growth, nutrition also affects a child's resistance to disease. Poor nutrition makes him vulnerable to infection. The effects of illness are circular, because when a child is ill, he doesn't eat as well as he normally would. This then affects his growth. Another environmental factor which can affect growth and development is emotional deprivation. Many studies have shown that when parents or other adult caregivers are indifferent or hostile to infants, they do not thrive. Furthermore, emotionally deprived infants have poor muscle tone. Their bones do not mature normally, and their motor abilities are retarded. There is increasing evidence that these babies also have abnormal sleep patterns, which may inhibit normal secretion of the growth hormone. Many babies in homes or institutions where affectionate care and handling are not provided suffer from what is called deprivation dwarfism. They do not gain weight normally and are below normal in height despite good food and medical care. Other aspects of environmental influences, such as visual and tactile stimulation, are also the subject of intense investigation. Studies of the effect of visual enrichment on normal infants suggest that there is a temporary increase in attentiveness and alertness compared with babies who have minimal enrichment or stimulation. However, for most babies in typical families across the world, the amount of visual stimulation is sufficient for normal development. While it is generally accepted that the sequence of motor development does not change, the children learn to hold their heads up before they sit and sit before they walk alone, researchers are interested in finding out whether intervention or practice can hasten the onset of various motor abilities. Babies are born with a walking reflex. When held up with their feet touching a flat surface, they will make walking movements. This usually disappears by about 8 weeks. In a study, a group of boy babies was given 2.5 minutes of walking exercise daily from the 2nd through the 8th week. They walked alone 2 or 3 months earlier than the accepted norm of 13 months. The researchers who conducted this experiment believe that if the walking reflex is stimulated, it does not disappear, but rather progresses to walking. Many believe there's no permanent advantage to the child from this practice. In addition, some researchers would prefer not to encourage early walking. They contend that creeping is beneficial to neurological development. Therefore, they would let babies creep as long as they would naturally, without intervention. Walking uses just one side of the body at a time, first the left leg, then the right. But creeping involves using both sides of the body at the same time, the right arm and the left leg, and then the left leg and the right arm. Therefore, both sides of the brain are being developed simultaneously. Some mothers of normal, healthy babies take their infants to formal exercise classes in the hope that the classes will accelerate motor development. Although practice in some motor skills may speed up their acquisition, many developmental specialists believe that gains are only temporary and non-meaningful. Most babies, they believe, have a natural desire for exercise and get all they need for healthy physical development. Despite individual differences in style and rate of growth, most infants in Western cultures do follow definite sequences of development. At birth, a newborn can see light, dark, and color. Her eye muscles develop very rapidly, but she can focus only on objects that are about 8 inches from her face. Infants just a few days old can follow the path of moving lights. They also tend to look at those stimuli that have a great deal of black-white contrast. At about 7 or 8 weeks, coordination and convergence of both eyes occur. And by 4 months, infants can focus as well as adults on objects at any distance, near or far. A very young infant has little control of her voluntary muscles. When placed on her back, she usually lies in a position called the tonic neck reflex. Her fists are usually tightly clenched. A baby can raise the head about a month earlier than the shoulders and chest. As he develops strength and control in his neck muscles, he begins to hold his head face up rather than toward the side. He can also turn his head in response to what he hears or sees, and his hands are usually open. Once the infant begins to focus at different distances and is no longer bound to the tonic neck reflex position, he spends a great deal of time looking at his hands and begins to swipe at objects within reach. He soon raises his hand close to an object and looks back and forth from the object to his hand many times. This is the beginning of visually directed reaching. After much practice at manipulating her own hands, swiping at objects, and alternating glances from her hand to an object, a baby is finally able to reach for and grasp it. She grasps with her whole hand, and she can't let go. She does not yet have voluntary release. When she does let go, it is usually because her fingers relax as she loses interest in the object. As a baby gains coordination and control of the voluntary muscles, she can roll over, first from her stomach onto her back, and later from her back to stomach. She can sit only with support at first, but as her back muscles become stronger, she's able to sit alone momentarily, and then for longer and longer periods. She can often sit in a high chair at about 6 to 7 months of age, just before she's able to sit alone. Before this time, she tends to slide out of the chair or may become tired and irritable. An important development at this age is the ability to transfer objects from one hand to the other. As fine motor control develops, a baby's grasp becomes more mature, and he is finally able to pick up small objects using just his thumb and forefinger. By now, the infants have developed their own unique way of getting around and can usually stand with support. By this time, most babies are very proficient at moving about on their hands and knees and delight in getting into everything. They usually enjoy taking things apart, even though they can't put them back together again. Although a baby's arm muscles are still usually stronger than his leg muscles at this age, he may be able to walk when led. Using the strength in her arm muscles, a baby can now pull herself up. As their leg muscles strengthen, they can cruise along, stepping sideways, holding on for support and balance. Finally, she sets out on her own. With her arms held out and her feet wide apart for balance, she takes her first jerky steps. She is now called a toddler. This walking or toddling is very distinctive and quite different from that of even the preschooler. Instead of striking the ground with their heels and flexing their knees to cushion their steps as older children and adults do, toddlers land on their toes or flat on their feet and keep their knees straight. Their hip motion is also different. Walking, of course, also affects the child's life in many other ways. The child can now, with increasing ease, leave or approach people, which some believe fosters autonomy. And since the child can more easily and more quickly explore areas that may be off limits or dangerous for her, she finds not only her actions interrupted or halted more frequently, but her will thwarted as well. Parents may also begin to treat their walking child differently, more as an individual and less like a baby. There is increasing expectations that the child will show more adaptive and compliant behavior. Once his walking ability is refined, a toddler begins to run. But since he cannot yet maneuver turns, he has to stop before he can change direction. The toddler often has an urge to carry objects, to push, pull, haul, or drag all sorts of things. The larger, the better. As fine motor control develops, a child can hold his own cup, and he begins to use a spoon. But the spoon rarely makes it to his mouth right side up. Voluntary release is developing now, and a child enjoys practicing his new ability by dropping things repeatedly. He soon develops more accurate release and can use this ability in his play. As release becomes more precise and advanced, a child can build a tower of 2 blocks. With advanced fine motor control, a toddler can build a tower of 3 or 4 blocks. She spills less often when drinking, but still tends to overturn her spoon. A toddler now has enough large muscle control to climb onto whatever he can reach. Around age 2½, the typical child has grown to approximately half his adult height. She can jump with both feet and can stand on one leg. His skills are becoming more and more refined. He can hold a cup with just one hand, and he no longer overturns his spoon. He can now build a tall tower and put things together. Although physical growth and motor development do follow predictable patterns and sequences, they can be hindered or accelerated by factors in the environment. Since each child is physically different, and since no 2 environments are exactly the same, every baby develops at his own rate and in his own unique way.